Hi everybody, I have really hesitated to do this video because the information is rapidly changing and I have like a real marriage to what's going on with COVID-19 because number one, I'm a practicing obstetrician and pregnancy is such an uncertain time for women. To add this additional outside influence has been really challenging for my patients. And I can't lie, for me as a provider. In addition, I also have a master's in public health and a health administrative certificate in emergency preparedness. So I was livid in the beginning of this because I know where the mistakes have been made from administrators, from health organizations, from the government at large. So it was really difficult for me to make an unbiased video. But I think we've gotten past a little pettiness. I could be a petty queen. And I want us to get down to basics and talk about some stuff because I think that there's so many myths, so many things out there that are really derailing us as a community and are really pushing this virus, giving it fuel. So I want to talk about that. So if you don't know me, because I have gotten a lot of followers in the last couple of days, crazy. My name is Dr. Ruth Arumala. I'm a practicing obstetrician gynecologist here in Mansfield, Texas, right outside of Dallas, Texas. And I love my job. I love it. So let's get down to basics. I wrote a lot of notes because not really notes, but just so that you can guide me because rabbit trails kind of are my thing. So let's try and talk about it. So why do we need to know about this virus and the disease that it causes? We need to know because knowledge is power, okay? We need to know because we can prevent ourselves from getting affected by this disease. And really what we have realized is that our behavior actually is the number one determinant of whether or not we're going to be exposed and whether or not we're going to be get sick. So guys, stay indoors, please wash your hands. Okay, we'll get into it. But you know, what is COVID-19 and what is coronavirus today? So coronaviruses are actually a family of viruses. I learned this when I was an undergrad. I was a cellular and molecular biology and genetics major, so this is our thing. We knew that coronaviruses were single-stranded RNA, meaning that they only have one type of genetic material, RNA, that don't have DNA, and they have a viral capsule around them. And they're a family of viruses that normally live in animals. This particular strain, they think, lives really in the bats. And a lot of these coronaviruses live in bats, but they usually need an intermediary host, meaning that they need another type of species before they get to the human species because they need to continue to mutate. And the intermediary host for SARS was what they thought were avian species like birds. And then for MERS was the camel, and MERS was first diagnosed and discovered in Saudi Arabia, where there are camels. And right now, the coronavirus that we have, that strain is called SARS-CoV-2, and we don't actually know what the exact intermediary host was that allowed it to get to humans. But in any case, it is here, and it is virulent. And what do I mean by virulent? It means that it can really attack humans or it's contagious really easily. It passes from person to person really easily. So some of the other coronaviruses, they actually have more, had more of an immune response in human beings, but they didn't pass as easily. Take, for instance, Ebola virus. Ebola virus, you needed to have close contact with someone who was really ill, right? When we talk about this particular coronavirus, you can have an asymptomatic person, meaning there are no symptoms. The person doesn't have a fever, cough, chills. They don't have any change in sense of smell or taste. They don't have any diarrhea, nausea, none of that. and you come in contact with them, meaning you're less than 6 feet away from them, which is kind of the determining factor. It's not exact. You're not walking around like, I'm gonna stay 6 feet away. But it's kind of like that. And so you can actually catch this virus and get infected by this virus without actually knowing that the person that you're around has been exposed and actually has the virus. And so what happens when the virus enters the body to cause the disease? So it causes an immune response, meaning that your white blood cells, which are your immune cells, are like, wait, what's going on? What is here? I've never seen this before. And it causes a massive attack on this virus, which can actually cause you to have the fevers, because your body will send out different kinds of signals called cytokines. And these signals are going to actually cause you to raise your body temperature, because it thinks if it's really, really hot, the virus can't survive. So it's going to denature the capsule. And so that's kind of what it does. But that can also cause because it's not going to differentiate, is this a viral cell or is this a human cell? That can actually cause damage itself. So many coronaviruses actually affect the respiratory system, which is your lungs, your bronchioles, which are little cells in your lungs. They can affect your hepatic system, which is your liver. They can affect your enteric system, which is your GI, like your intestines. But this particular virus, it can also affect your neurons or your nerves. It can have neurologic effects. But this particular virus loves the respiratory tract, but sometimes can give you things that are more enteric, such as nausea, vomiting, and change of bowel movement, meaning diarrhea. So in the beginning, there was a lot of talk about you cannot actually have the virus or have the disease without a fever, and that has been debunked over time. Okay, so that's kind of how the disease works in your body. And what the COVID or the coronavirus wants to do is take over the machinery of your respiratory system and help you and kind of use your cells to replicate itself. That's what viruses do. They try to use your own cell machinery because they don't have it. They just have the genetic material and the protein capsule. So herein comes our only line of defense, because we don't have a vaccine and we don't have a treatment right now that is 100%, this is going to cure it or this is going to treat it. We have some ideas, and I'll talk about those ideas. But the best thing that we have right now is prevention. Prevention. I know you've heard it, but stay in your house. Please stay in your house and try to stay away from other people. Social distance. Don't congregate in big groups. Don't, because you have no idea where these other people are coming from, what they're bringing with them, okay? When you wash your hands thoroughly for at least 20 seconds. Wash under the fingernails. Wash like a surgeon. When I wash, I'm washing in between. I clean underneath my nails. I clean, I wash, and wash frequently. That's the one thing that can come out of this, is that we improve our hand hygiene. And make sure, I'm one of these people that I do it all the time. I love to touch my face. That's part of human nature. We just love to touch our faces. But most of your skin has an extra layer called keratin over it. Your eyes, your nose, and your mouth don't. They're mucous membranes, so they can readily accept things. So you want to make sure that you take your time to make sure you're preventing touching your face with things that can still be on your fingernails. Wipe down your surfaces. Become really focused on doing that, because the virus can actually live on surfaces for hours and hours. So we want to make sure we wipe our surfaces. If you have to go, you have to buy food, right? You have to find for the holy grail, toilet paper. You got to find those things. Make sure you're taking something to wipe off the handle. Make sure you're social distancing. Try to limit your interaction with other human beings. We are social as human beings, so this is difficult. But this is our number one hope at this point. The second thing is, if you are to have any kind of symptoms, and the symptoms include fever, chills, just feeling unwell in general, muscle aches, cough, sneezing, if you have any kind of loss of taste and smell, you have diarrhea, nausea, vomiting, those are reasons to call your health provider, because they're going to be able to send you to get tested. If you have allergies, which is still geez, it's April. It is very like the height of pollen season. If you have allergies, or it's still kind of flu season, so you could have one of those other things. You could also have rhinovirus, which is a common cold, but you could also have COVID. So we want to make sure that we protect our health providers. So call your health provider so they can tell you where's the nearest place for you to get tested for COVID. Okay, so I'm not going to go into the treatments and stuff, because really that's not the point of this video. That becomes really intricate. So I want to deviate and talk about my people, which are pregnant women. So if you're not pregnant right now, you can just skip forward, because I will talk about other things. But if you're really interested, stay tuned, because pregnancy is unique in general. It's unique because our body lowers its immune system, because we need to grow a whole human. So with that being said, the real question is, are pregnant women at risk for having increased or a more severe respiratory illness? And number two is, does the virus cross the placenta and can it reach my baby? If I was pregnant, I would ask that question. And I'm telling you, every single one of my pregnant patients that kind of have an idea of what's going on, ask that question. So, first question, we don't know the answer to that. I'm so sorry. We don't think that it does. The pregnant women that have been seen in other countries that have been infected with COVID don't seem to have a worse prognosis than people who were not pregnant, if that makes sense. However, because we know for sure that the influenza virus affects pregnant women more and leads to acute respiratory distress syndrome, we tend to make sure that we take care of the pregnant patients as if, with more precaution. Does it cross the placenta? Again, there's no evidence for that at this time, which is April 1st, 2020. This may change as we learn more about the virus, but this is where we are now. The next question that I get is, my God, we have all been talking about for the past couple of years, maternal mortality in Black women is crazy, right? It's 3 to 4 times more than that of other races. So, Dr. Rumala, am I at worse risk right now? The truth of the answer is, I don't know. I do not know, and I wish I knew. I wish I knew so I could give you a concrete answer. However, I think that you should work on the first thing I tell every pregnant woman is make sure you and your provider, you trust them. Because pregnancy is unpredictable. A lot of things that occur in pregnancy don't occur outside of pregnancy. And you have to really trust that this provider, whether it's a midwife, whether it's a physician that's an obstetrician, or if it's a physician that's a family medicine or OB, make sure that you really trust your provider. Because they're going to be telling you to do things that you may not actually understand or be able to determine, is this just because, you need to just trust your provider. I think it's hard to kind of go through all the scenarios, but trust your provider. That's the first thing. Now, I actually am a strong advocate for having a lot of pregnancy support. So I'm a strong advocate of doulas. I'm so sorry if you don't agree with me and you're an obstetrician. I'm not going to hide my face because I'm not actually sorry. I think doulas really help with navigating pregnancy, and especially the good ones, the experienced ones, and the ones that know evidence-based medicine, right? So I would encourage you to look for a great doula that has the capability of FaceTiming with you, because as we know, because of limited exposure, hospitals are changing their policies, and that includes labor and delivery. Many hospitals are only allowing one support person, so you got to choose your mama or your man. That's kind of what's happening right now. And it seems so cool because if I think about my pregnancy, I sit here and I think about my pregnancy and I'm like, I'm gonna have my mama in there, I'm gonna have my best friend in there, I'm gonna have my man in there. He might not be able to look down here, but he can see. So, you've gone through all the processes when you were having your gender announcement, when you were having your baby shower. You had all these thoughts. You might have actually sat down and come up with a birth plan, exactly how you want it to go, which I do encourage. I actually encourage all my patients to have a birth plan, but then I encourage them to have the flexibility. There's a lot of things I won't do because they're not safe. And then evidence-based. And I am an ACOG girl, meaning I do what my college has looked at and determines is safe, okay? Because I want to take care of you and I want you to have the best possible outcome. Speaking about ACOG, the next question that a lot of people ask is, should I have my baby at home now? Because this will allow me to have whoever I want there. That's the question I get. And I have to say what ACOG says. Every woman has the right to deliver wherever they want to deliver, as long as they, one, have no contraindications, two, have, and we'll go over the contraindications in a little bit, two, have been well counseled on the risk and the benefits of having a home delivery, and three, they have access to a hospital ASAP. So the contraindications are that you haven't had a prior cesarean section, you do not have a twin gestation or a higher order, you don't have malpresentation, meaning that the butt or the leg, meaning it's a breech presentation, you don't have that. Those are contraindications, and there's some other things like placentation issues, meaning like the placenta comes before the baby. So talk to your health provider, that's what I should say, okay? Talk to your health provider about that. And then, but ACOG also says this, that the best place to deliver your baby is a hospital or an accredited birth center. So that's what I'm gonna stick with. And I love delivering my patients in the hospital setting because if anything possibly goes wrong, because there's no prophecy in obstetrics, we have no idea what's gonna happen in 5 minutes. So I can act quickly. That's what I love about being an obstetrician. So we're gonna move aside from pregnancy and talk about women's health in general. So I will tell you this, as a person that's growing a practice really rapidly, I was really bummed because we had just gotten in our stride. We had just started taking care of patients in a way that I love to. I do a lot of gynecology and I do a lot of surgery, and I was just getting to the point where my surgical load was building up because I have patients I specialize in fibroids. I have a lot of patients that have fibroids. But those kinds of surgeries are considered not elective and not necessary, meaning that the state of Texas and many other states are not allowing us to do elective surgeries at this time. But because it's considered an elective surgery, does not mean that it doesn't affect my patients' lives at the core and the root. If you are one of my patients that cannot get up without looking behind her to make sure that there's no blood on the seat, you know that you feel like, what's going on, God? I was ready for this. I prayed about this. I fasted for this. I found the person that's going to do this surgery for me in the method that I feel comfortable with. So I really feel for my patients at this time. I really do. And I hope that this pandemic moves along in a way that we can restore back the things that we need, because people have medical issues outside of just the pandemic. However, from a public health perspective, it makes a lot of sense to wait and not use necessary blood products, all the other things like Lasix, anesthesia, things that are necessary that we need to preserve and are running in shortages because our health system is being taxed. I want to make one more mention about the other types of patients that I have, patients who are going through their fertility journey, and everything has been put on hold. I really understand and I feel you on so many levels. And I just want to reach out to you today and give you a virtual hug. Come here. I'm gonna hug you right now. Give you a virtual hug and just tell you that I really understand what you're going through, but this too shall pass. So that is my kind of personal, sort of professional mixture about COVID-19 and how it's affecting my patients and just some basics about it. But I want you to really reach out to your health provider, especially if you're going through a lot of anxiety. I'm going to tell you a personal story really quickly. Yesterday, I had to turn off everything. Social media, YouTube, because I watch a lot of YouTube. I stopped reading articles because I read 2 or 3 articles about COVID every single day. I had to turn off because I started panicking. Why? I know a lot. And I have older parents. I have a boyfriend halfway across the world. I have his family to worry about. Those things can really give you a lot of anxiety. A lot can really depress you. If you're going through that, reach out to your provider. Ask for help. It is not a sign of weakness, my dear. I reached out to my friends who are providers. Okay? So, again, my name is Dr. Ruth Rumala. It's been my pleasure talking to you about everything that's going on right now, and I'm sure I'll make an updated video, but it's really nice to meet you over camera. And we'll talk soon. Bye.